Good morning, and thank you for joining us this morning or this afternoon, wherever you're located, for today's webinar. I'm very pleased to be moderating this session on the digitization of cash assistance during the COVID-19 pandemic in Colombia. My name is Rebecca Rouse. I'm the Director of Financial Inclusion at Innovations for Poverty Action. And I'm really pleased to be able to share these results from this study, which was on the impact of the VAT Compensation program in Colombia. This project was a collaboration between IPA Colombia, and our research team and the government of Colombia, who I'll present on the next slide. So I'm very grateful today that all of our partners could participate and share these results in one of the first times that we're seeing the findings presented publicly. And the paper that this presentation is based off of is available on our website as well, and we can share that at the end of the presentation. So just quickly, we're going to start out with the presentation of research results, followed by response from our government counterpart from Colombia. And then we'll have some time for Q&A. So please do save your questions. You can enter questions into the Q&A box on Zoom here. So, feel free to put them in as we go if something jumps out, and we'll definitely try to address everybody's questions during the Q&A and have a lively discussion. Great. So, Luciana, next slide, please. I'm very pleased to introduce our speakers today. Again, the first two folks on this slide are our principal investigators for this study, Dr. Juliana Londoño Vélez, who's an assistant professor of economics at UCLA, Dr. Pablo Querubin, who is an associate professor of politics and economics at NYU. Our government partner, Olga Lucia Romero, who's the director of monitoring and evaluation at the National Department of Planning in Colombia. Next slide, please. Great, so just to start out, I think this project really is an example of what IPA does best, which is to co-create evidence by bringing together academic researchers and governments to work together to incorporate opportunities for data collection and research into programming, and then use that evidence to inform program improvements or program modifications over time. So, I think this project was done in such an even more challenging environment because it was during the early weeks of the COVID-19 pandemic. So, a massive emergency when the government of Colombia was scrambling to get assistance out to its citizens, even more challenging time to think about incorporating research, especially a randomized control trial evaluation. So, we are really grateful to the government of Colombia for trusting us to work with them during this time period to make sure that we were capturing lessons from what was happening and giving that feedback to the government, and hopefully contributing to the improvement of these programs for the Colombian citizens. Next slide, please. So this work is part of a larger IPA's broader COVID-19 response, which we call RECOVR. So this includes rapid response surveys, a global hub that centralizes research and policy lessons on our website, and assistance to governments on advising on evidence-based approaches to addressing the pandemic. So please do, if you haven't already, check out the RECOVR website on IPA's, or the RECOVR page on IPA's website, and there's more information about all of the research that we've got going on related to the pandemic response, and also a link to the full paper that this study or this presentation is based on. Next slide. Great. So just a little bit more context for this study and this work. So cash assistance has obviously been a really important part of government's COVID-19 response throughout the world. Since March, 156 countries have introduced 340 cash assistance programs globally, which represents 50% of all interventions in response to the pandemic. Colombia really did make history with the massive enrollment of new beneficiaries onto cash assistance platforms, and then particularly new users of digital financial services within record time. So this study and this presentation focuses on the Compensación de IVA program, or the VAT Compensation program. This is one of multiple programs that the government had launched, including Ingreso Solidario, which is another large cash transfer program in Colombia. There's another evaluation of the Ingreso Solidario program that's happening right now, which we hope to have more information about in the first half of next year. But this study really focused on the VAT compensation program. The other thing I'll mention quickly, kind of in this whole global context of cash assistance and digitization of cash assistance, many of you might have seen that IPA is hosting another webinar this week on December 18th on the impact of cash transfers in Africa, looking at programs in Kenya, Uganda, Liberia, and Malawi. So that work is drawing from programming from Give Directly and a universal basic income study in Kenya. And so I think it'll be really interesting as we look at the results from Colombia to think about how they might compare to other similar programs. And I think during the Q&A, we'll be able to have a little bit more of a conversation about where we see this study and this intervention kind of fit in that context. But I just wanted to quickly plug that December 18th webinar as well. Great. So yeah, again, focusing on the VAT compensation program and this massive enrollment. In 2018, the Global Findex reported that only 4.7% of adults in Colombia had a mobile money account, and only 12.5% of adults were using any kind of digital account to receive government payments. And so that's really the place that this work was starting from, that the government was starting from when they launched these programs. So this study looks at the impact of the VAT compensation program on financial health, food access and food security, political attitudes, and other outcomes. And in addition to looking at those impacts, does create an opportunity to better understand what happened with the rollout of the digital delivery channels in this context. Again, reaching new users of mobile money for the first time during this really critical moment. So yeah, I mean, again, we're really grateful for this collaboration, and I think we'll be able to use these results not only to help inform the future of these programs, but also I think there's a lot of lessons for other countries and other contexts here as well. So with that, I'll step back and pass it off to Juliana to actually show us the results. Thank you.
Thank you so much, Rebecca. Okay, so hello everyone. My name is Juliana. Let me just motivate this research a little bit. So the COVID-19 pandemic has really affected millions of citizens around the world. And the welfare impacts are predicted to be particularly devastating in the developing world because informality is pervasive and governments are, have both tight budgetary constraints and a very limited capacity to reach the most vulnerable citizens. And so, as Rebecca was mentioning, governments have responded by providing emergency assistance to households with cash transfers representing roughly a half of all social interventions. And so we think that it's critical to understand the effect that money has on household welfare during a pandemic. In normal times, even small amounts of money may have a sizable impact for households that live in extreme poverty. In a pandemic, however, there are disruptions in markets and supply chains that may dampen the effectiveness of money. And given the urgency to reach and provide relief to households, many countries have actually sought to improve cash delivery by turning to digital cash, which is something that we'll talk a lot about today. And we think that this might have a differential welfare impact during a pandemic by, for instance, influencing households' compliance with social distancing. And so what we're going to do today is study the impact of money during the COVID-19 pandemic for households who are living in extreme poverty in Colombia. Next slide, please. Great. So on March 2020, March of this year, Colombia rolled out a new unconditional cash transfer, a UCT, to help households who are living in poverty deal with the economic consequences of the pandemic and the national quarantine. This UCT is a value-added compensation that, unlike a VAT refund, it does not take into account the VAT that's actually paid by households. That's important because instead, it's designed as a recurrent UCT that's of a fixed amount. And as such, it can really be thought of simply as an expansion of cash transfers to the poor. So then I'll be using today the terms UCT and VAT compensation interchangeably. The transfer was initially created and implemented by Colombia's Department of National Planning, the DNP, and it's now being handled by the Department of Social Prosperity, DPS. The way it works, it's a transfer it's currently being paid to 1 million households who already receive social assistance, namely Colombia's Conditional Cash Transfer Program Familias en Acción, and who live in extreme poverty. Those are the two conditions. And extreme poverty is really defined using the main proxy mean score, CISBEN. The value of the transfer is quite small. So it's worth $19 per household at the market exchange rate, and it's paid every 5 to 8 weeks. And so if you convert that, that's equivalent to 18 cents per adult per day. So it's quite modest in size. And it's paid either in physical cash or via mobile money. In the midst of the national quarantine, Colombia expanded mobile money as a method of payment, just something that I'll come back to and discuss later. So I think, yeah, thanks. So here's a nice visual of the way the program was introduced. This is a little sign in Spanish that says, for the first time, Colombia is giving back value-added taxes to the most vulnerable citizens. And it's really a way that was presented as a way of increasing consumption capacity for low-income households. Okay, next. Great. So we want to know, what are the effects of emergency cash assistance on financial, physical, and mental health, political attitudes, and household behaviors to mitigate the spread of COVID-19 during the pandemic? And I'll walk through why we chose each of these measures. To answer these questions and to evaluate the impact of the program, the government conducted a randomized controlled trial, an RCT. And so this is going to be one of the first RCTs that evaluates the effect of a new cash transfers for COVID-19 economic relief and the implications of expanding digital payments during the pandemic. The RCT sample is as follows. So we have 3,462 eligible households, where we define again eligibility as those who receive Familias en Acción and who live below a poverty threshold. And these 3,400 households are going to be scattered in 53 randomly selected municipalities in the country. Among these households, roughly half are randomly assigned to treatment and half are randomly assigned to control. To estimate the impacts, we collected, with the help of IPA in Colombia, collected phone survey data in June of 2020. So that's 3 months after the pandemic first was detected in Colombia. I'll get to the timeline in a second, but basically what you should know is this is a moment where we survey households very shortly after the second VAT compensation was made. And what we do then is we're going to complement the information from the survey with 35 qualitative interviews that were done in October of this year, so just 2 months ago. Okay, so here's a timeline of the events. The first transfer took place in April, shortly after the country went into quarantine. The second wave took place in May. And so we're going to survey the RCT sample in early June, which is shortly after that. So keep in mind that during the entire period, the country is under strict quarantine orders. So we're going to be evaluating the impact of money at the height of Colombia's quarantine. Next slide. What we're going to do is we're going to use administrative data linked with household surveys. The administrative data merges CISBEN 3 and 4 databases. So CISBEN is the main proxy means test instrument of the government. It was updated and now there's a 4th version. We have both versions, and so we use that and we merge it with information from DPS on who are the conditional cash transfer household recipients, as well as the VAT compensation recipients, when they got the money, how much money they got, where they got it, and the mode of payment. The survey response rate that we did is 59.3%, and it's balanced between treatment and control. Given the sample of eligible households, as I mentioned, they're all recipients of Familia en Acción, the respondents are going to be disproportionately female and unmarried. So that's our main sample that we're working with. And then, as I said before, we complement this information with 35 qualitative interviews that were run by IPA Financial Inclusion Program in October. It was stratified based on payment modality, so cash versus mobile money, and whether or not they reported problems in the June survey regarding the use of the mobile money app. Okay, next slide. So let me begin by describing households' conditions during the pandemic. Households in our sample are remarkably vulnerable. So in addition to living in extreme poverty, 43% of them are victims of the Colombian internal armed conflict. 70% of survey respondents worked in February 2020. So that's before the onset of the coronavirus pandemic. And consistent with a very pervasive informality among this population, 87% of such individuals worked without a written contract. So that's almost 9 in 10 workers being in the informal sector. Among these pre-pandemic workers, just over a quarter worked in agriculture, another quarter worked in the domestic service, 12% worked in hotels and restaurants. By June, so only 3 months later, only 43% of individuals who worked before the crisis reported working for pay in the past week. What this means is that 57% of those who worked before the pandemic no longer had a job or a work activity by the time we surveyed them in June. And so as a result, when we asked them to list their main source of concern regarding the effects of the coronavirus crisis in Colombia, most households responded with economic needs far beyond any other category, far beyond their own health concerns. And so this really highlights to us the devastating effects, devastating economic effects, of the pandemic for these extremely poor households. Since most recipients are parents, we asked them to list the difficulties that they faced regarding their children's education during the quarantine when schools were closed. 46% of them, so almost half, reported a lack of access to the internet as being the main difficulty that they face. This is a population where only 35% reported having access to the internet for the most part of the month of May. So which really points to the digital divide as a critical divider of disparities that are emerging during COVID-19. The last point I'll mention here is that food insecurity is high among our population of study. 58% of control households reported having to limit the portion size at mealtimes at least once in the month of May. Okay, so now let me briefly summarize the study findings. Looking at household well-being, we find that the transfer had a positive effect on financial well-being during the quarantine. It reduced the likelihood of selling belongings by 15.3% from a control mean of 21%. And it also decreased the probability of having to deplete your savings, of borrowing money, of skipping a loan payment, of stopping other mandatory payments, or pawning belongings. So it helped improve financial security. Now, turning to food access and food security, we see that 90%, more than 90% of households that were surveyed reported to spend the VAT compensation on food. So, overwhelmingly, most households say that the money is really spent on getting access to food as a first priority during this critical period. And this is, going to be consistent with what we find, which is that consistent with improved access to food, money boosted the probability of purchasing food in the last week by 6%. This economically small impact, I should recall, is concomitant with the small size of the VAT compensation. If you remember, it's only 18 cents per adult per day. Despite widespread food insecurity, we cannot reject the null hypothesis that the transfer had zero impact on food security. So we reconcile this result where we find very large both quantitative and qualitative evidence that the transfer had a big impact on food access with no statistically significant improvement in food security, as noting that the transfer might have been spent on improving the quality and the diversity of the diet. So like increasing items that are rich in protein, such as milk, meat, and eggs, which unfortunately our short phone survey didn't capture. but it is consistent with the qualitative interviews that support this. And it's also consistent with previous evidence on the conditional cash transfer program Familias en Acción, which shows that the transfer improves the quality and diversity of food intake for poor households. Moreover, the transfer we find had a positive, modest effect on parental investment in their children's education. So for instance, it more than doubled the likelihood of paying for tutoring. And moreover, the qualitative interviews also suggest that parents use the transfer to purchase schooling materials like photocopies and mobile internet service for their kids' remote learning. These gains tend to be driven by urban households, and this is going to be consistent with evidence that is emerging from other countries that rural areas has been less likely to expect teachers to provide instruction during the COVID-19 pandemic, partly due to this very large digital divide. Okay, so in the context of a pandemic, governments require citizens' compliance with restrictive measures to prevent the spread of the virus. So we want to ask whether social assistance translates into greater trust and or support for government policies addressing the coronavirus crisis. And what we see is that there is widespread support for government policies, including the quarantine itself, even among these extremely poor households who are clearly suffering from the impacts of the pandemic. We see that treated households are 7.4% more likely to support emergency assistance for households and firms that are being rolled out by the government. And we also find that unlike support for these government assistance programs, however, neither trust in the government to look after its citizens nor support for the government's lockdown to flatten the curve of the virus are going to be influenced by money received during the pandemic. The other thing that we found is a qualitative, next slide, qualitative interviews that revealed a deep sense of community among the household. So for instance, people asked their neighbors for help to verify their eligibility for the VAT compensation and to learn how to use the mobile money app. And the treatment appears to further heighten reciprocity during the pandemic. So treated households are 3.4% more likely to be willing to contribute with work, though not money, because these are very cash constrained households, to support their community. And so this suggests as further evidence that social assistance programs can also have indirect welfare impacts by promoting other forms of social cooperation. Okay, lastly, I want to dedicate the last 6 minutes to the very important point of digitization of cash assistance. So in the middle of the national quarantine, Colombia achieved a record time expansion of mobile money as a method of payment for all social assistance programs. Among treated survey respondents, the share of mobile money transfers almost doubled from the first payment that was done in April to the second payment that was done the following month. And it, at least to the least that we know, it's at least 75% today, the share of transfers that are paid through mobile money wallets. So mobile money we find is disproportionately used in urban and wealthier municipalities, as well as in urban areas. Because connectivity is going to be more difficult in remote areas with the weak or unstable cellular connection. And we'll get back to this point later on. What we see is that despite the well-documented benefits of mobile money in the academic literature, introducing this new payment technology during the pandemic did inflict a cost on households. So roughly a fifth of households reported to have experienced delays or difficulty with the VAT compensation. And this share is more than twice as large for households who receive mobile money versus physical hard cash. The use of the mobile money app was the most frequently cited problem. So instead of making transactions with the mobile money app, as we've seen occurs in other countries, households really reported wanting to just cash out as soon as they could to purchase goods with hard physical cash. And so this urgency to cash out, to consume, might affect people's compliance with the strict quarantine. So to investigate this issue, we asked participants whether they had left their home in May for a particular reason, including having to go to the bank or the ATM. And so we see that the cash transfer raised the likelihood of having to go to the bank or the ATM by 24%. And this effect, importantly, does not vary by whether the transfer was paid in physical cash or in mobile money. Because the transfer induced households to leave their home to collect the money, it had a small negative impact on individuals' behavior to mitigate the spread of COVID. And so this really, we find, clashes with the notion that digital payments can offer the opportunity to distribute cash transfers in a manner that's compliant with social distancing. And here's where we decided that it would be very useful to have qualitative interviews. So the qualitative interviews shed additional light on the challenges that Colombia faced with its expansion of digital payments. Colombia's digital payments ecosystems is relatively less developed, so few merchants accept digital payments, and mobile commerce is very much still in its infancy. And what the qualitative interviews reveal is that the benefits of mobile money are not always perceived by households. So none of the interviewed individuals reported purchasing food or services with mobile money, with the exception of call credit that they could do through their phones. So the digital provider is considered to be a means to an end, which that end being just having hard cash so they can consume, rather than a financial product that clients see themselves adopting in the long term. We also find that in rural areas, poor cell phone connectivity and gaps in technological capacities negatively affect the use and experience with the digital provider. And clients who are themselves, let's just remember, living in extreme poverty, bear the cost of this lack of connectivity. There were also a lot of reports of having to cash out. There's a burden of cashing out in terms of time and travel costs, spending hours going to the ATM, especially in rural areas where these connectivity issues are critical. And so to sum up, because I have a minute and a half left, although introducing new payment technologies during the COVID-19 pandemic may facilitate the rapid disbursements of money to vulnerable households, our results suggest that it can also undermine their effectiveness in context with underdeveloped digital payment ecosystems. And Colombia's experience with this contrasts with Kenya's experience with Universal Basic Income, UBI, that was paid via M-Pesa, the mobile money technology that's widely spread in Kenya during the pandemic. So there's two reasons for this. One is that Kenyans were ex ante quite familiar with the program's operation because the UBI, the Universal Basic Income, had been in place since 2018. And second, Kenya already had a very well-developed digital payments ecosystem. So there's evidence that more than 96% of Kenyan households had a mobile money account before the pandemic. In contrast, Colombia's VAT compensation was launched in the middle of the pandemic with a little-known mobile payment technology that was solely used by recipients to cash out. And so as a result, while Kenya's UBI encouraged households to stay home during the pandemic and make payments electronically, Colombia's program induced households to leave their home. And so our results suggest that there's space to strengthen financial education and literacy for new clients. And it's also key to improve the infrastructure needed for mobile money. So that includes improving connectivity in remote areas and encouraging businesses to accept digital payments. And so overall, we see that our results highlight the importance of developing digital payments ecosystems to facilitate the easy deployment and the efficacy of cash assistance during crises. Thank you.
Thank you very much, Juliana. I will pass it over to Olga now so we can hear a little bit about the government's interpretation of the responses or these results. How was this experience of conducting this evaluation from the perspective of the implementer and what comes next?
Thank you, Rebecca, and good morning to all. And thank you, IPA, for organizing this webinar and presenting these interesting results from this evaluation. I'm going to share my screen. One sec. I think it's working. So I want to make some reflections first on digitalization of payments, why the decision was made from the government to move into this area. How do we also decide from the planning department to have this alliance with IPA and with the researchers with Pablo and Juliana. What is our first reaction to these findings, and how are we going to use these findings to inform the future of the program, and what questions do remain and we want to explore further. So why do the government move into these mobile payments? Given the pandemic, and as Juliana was mentioning, we wanted to avoid agglomerations. Obviously, the results of the evaluation show that we didn't have the expected effect on that. Also, we want to promote the financial inclusion. And something important is that the financial operator that helped with this compensation program had already a virtual wallet. So that facilitated moving quickly into the digitalization of payments. Something important to remember is that the beneficiaries of the value-added tax program are the same as the conditional cash transfer program of Colombia, Familias en Acción, and they already have a payment schedule and channel, and that also helped that we could be able to move quickly into this rapid digitalization of payments and give them the money. But the government is doing more efforts into continuing to this promotion of digital payments and financial inclusion. One important aspect is the national policy that just came out for financial inclusion and economic and financial education, which hopefully is going to help with these recommendations that come from the evaluation to move forward into this financial inclusion. And also the Ingreso Solidario program, which is a great effort into moving also people into these mobile payments and financial inclusion. So why did we decided as the National Planning Department to have this alliance with IPA and researchers? One of our missions in the Planning Department is to generate monitoring and evaluation of policies, and we seek to generate this quality information for better decision making. However, our cycle and process of evaluation could take over a year to have results, because what we do first is that we select the policy that we want to evaluate, we select that intervention, then we design the evaluation. That takes some months, and then we go into a public bidding so that we could do these evaluations, and then finally we go into the process of developing these evaluations that have all the process of methodology, design of instruments, collection of data, process and analysis, and finally we have the results and we do the socialization and we use the results. But the pandemic brought us some challenges, and we have to be innovative. We have to innovate in some ways on carrying out these evaluations so that we could have more timely results for policymakers to make decisions. And we also have to be innovative in the data collection process, right? So we went in these conversations with IPA and with the researchers, and we could make this evaluation in a faster and rigorous way for us to make decisions. So this is why we ended up in this alliance, which has been a very good alliance, and we have results now for better decision making. What are our reactions to the findings? So there are some findings that they are not as surprising. Obviously, that help us see where we have to strengthen and where we have to improve the program. These are the findings that we find that are probably what we expected. Obviously, the coronavirus had an impact on vulnerable households. The value-added tax program had some positive effects on the household welfare, as Juliana showed us. and there is a support for the government measures to confront the COVID-19. And we did a great effort to move these digital payments in record time during the quarantine. However, there are some other findings that could be surprising and could help us think further on how to move and improve also the program. The effects on education led us to think that probably we already have some effects because of the conditionality of the Familias en Acción program, because you have to remember that these beneficiaries are the beneficiaries of the CCT program in Colombia. So probably the fact that the families are spending money on education is letting us think about probably some effects that we already have because of the conditionality on education. Obviously, the unintended effect of not compliance on the quarantine was not what we expected as the government, but that do let us think on how can we improve these mobile payments and these financial inclusions, which is also related to the findings that the researchers found on the difficulties to move to have these mobile payments, especially in the rural area. So those do give us some insight on how do we have to move forward on the implementation of the program. So how are we going to use these findings? The importance of the findings is first on the evaluation. From the direction of monitoring and evaluation in the planning department, we know that evaluation is a fundamental element for good governance, because it will help us ensure the effectiveness of public sector and improve the quality, delivery, and response and efficiency of this value-added tax program. So the program continues to operate. It is expected to be expanded in the next year, in 2021. So the results of this evaluation will help us improve the program and its intended effects. And also the positive effects that the evaluation found encourage us to continue strengthening the targeting system and also the delivery mechanism of the program. These findings will also help us contribute to the other evaluations that we are conducting right now, as the one of Ingreso Solidario, and we will be able to have more information to have a better financial inclusion in the future. So some questions that remain and that we want to continue exploring, and that we hope that we will be able to have some results by next year. One is the differentiated impact in the mode of payment, cash or mobile money. And we are conducting an evaluation of Ingreso Solidario program to explore this program. We are doing some encouragement designed to find out this, and so we could be able to say more about if there is some different impacts because of getting money by cash or mobile money. Also, do impacts change over time? We are conducting a medium-term evaluation to explore those medium-term effects and try to see if these findings that Juliana just showed us do last over time, or how do they change over time. Also, since this is a value-added tax program and we are compensating this value-added tax, we want to see if there is a change in tax compliance by beneficiaries of the program. And this is also a question that we want to tackle throughout the behavioral component of the medium-term evaluation. This medium-term evaluation is in the process of being hired right now, and we are hoping that we will get those results by the second semester of the next year. Also, the one of Ingreso Solidario, we are hoping to have the results by the first semester of next year. So these are some of the questions that remain and that we want to continue exploring, and that the evaluation, the results that Juliana just showed us left us and that we want to continue exploring further. So with this, I finish. Thank you.
Thank you very much, Olga, and Juliana, for your presentations. So there's a few questions coming in the chat, but before we get to those, I wanted to ask a question that maybe Pablo can respond to, just about how we should interpret these results in the context of other work that's coming out on cash transfers, during COVID times, but then also more broadly, and especially the digitization of cash transfers. I know that Juliana touched a bit on this in her presentation, but I'd love for you to kind of explore that a little bit.
Yeah, thanks, Rebecca. So indeed, I think in our context, another study that's very relevant that may help us put some of the findings in a more comparative context is a recent study by Abhijit Banerjee, Tavneet Suri, Paul Niehaus, and co-authors that explore the role of the Universal Basic Income, or UBI, in Kenya. And I think, contrasting the experience of Colombia with Kenya's experience is very useful. So first of all, a very relevant finding, and this relates to some of the questions that was just raised in the Q&A, has to do with compliance with social distancing and the quarantine. So they find that in the context of Kenya, the UBI that was transferred through a digital platform such as M-Pesa did facilitate compliance with the quarantine and social distance, meaning it did allow recipient households to stay home, while in the Colombian case, we find no difference in terms of complying. Well, we find that no difference between cash and digital recipients in terms of compliance with the quarantine. And we find that if anything, recipients of the VAT compensation were more likely to leave their homes in order to cash the transfer. So what explains the reason why in Kenya, digital payments facilitated compliance while in Colombia they didn't? Well, first of all, Kenyans were ex ante more familiar with the program's operation, since the UBI had been in place since 2018. While in Colombia, in the particular case of the VAT compensation, this was a new program that was launched during the pandemic. Second, Kenya had already a well-developed digital payments ecosystem. So 96% of Kenyan households had a mobile money account before the pandemic. And as you probably know, M-Pesa is a very widely used digital form of payment. Businesses receive payments via M-Pesa very frequently. So if you received a digital payment, you could pay for different items digitally without having to leave your home. While in Colombia, the digital ecosystems is still pretty underdeveloped, and thus, if you wanted to buy food or groceries, you still needed to leave your house to do so. Related to the fact that the program in Colombia was launched during the pandemic, there was an unfortunate fact, which is that even prior to the pandemic, the Colombian government had decided to change the bank in charge of administering the transfer. So this meant that, in the middle of a very complicated times, households had to learn how to use a different platform, a different phone app, this mobile wallet called Davi Plata. While again, in Kenya, households had been familiar with these digital payments for a while. So, we believe that although introducing these new payment technologies during COVID-19 may have facilitated the rapid disbursement of money to vulnerable households, in context with an underdeveloped digital payments ecosystem like Colombia, its effectiveness was a little bit undermined, particularly with respect to compliance with the quarantine or social distancing.
Thank you very much. I have a question related to the delivery again for Olga, because I think the one actor that's been left out of these conversations so far is the financial service provider. So, this program was working in partnership with a commercial financial service provider. How was the experience of working with them to roll this out? What was their response to seeing these results, and what were the challenges or learnings from this partnership that other governments might take away from your experience?
Thank you, Rebecca. That's an important question. The financial institution that helped us with this rollout is the one that actually right now at the national level has the possibility of these mobile payments, right? So another financial institution is not, right now will not be able to have this movement quickly as we did. So that's something very important, is that the financial institution that we work with, and as I mentioned at the beginning, had the capacity at that moment to help us roll out these digital payments quickly. So that is something very important. They have seen the results, and what they are at this moment saying is that they understand the limitations that they have, and they agree with some of the results, and they see the possibility of moving and changing to move forward and make these changes so that the digital payments could reach further places and reach in a better way. We also see that we have to work in hand with these financial institutions in this policy document that I was telling you that just came out for financial inclusion and financial literacy and education, because we understand that we cannot do this alone as governments, that we have to work hand in hand with the financial institutions so that the results that the evaluation is showing us, we could improve in the future.
And related to that, one of the questions that came in the chat is whether or not there was any kind of assistance for enrollment into the product, or encouragement, or any kind of intervention besides just having the choice of opening the digital wallet.
Yeah, well, there was information in the web page, but there's really not like a program or like something more structural of telling people how to get into the mobile payment. And definitely that is something that from the results is telling us that we have to concentrate for further moving into the program. And it's something that we are planning to see also in the Ingreso Solidario evaluation, as we are thinking of doing some encouragement for people to move into the mobile payments so that we can see also that.
And then there was another clarifying question that came in just about this, because I think the thing that really stands out here is that the digital tools didn't fulfill that promise of making it easier for people to stay home, right? But just to clarify, the people who received the money through digital channels, were they more likely to go out than people who received the cash, or was it the same? So was it worse than the cash, or just the same? No difference between cash and digital.
I will let Pablo answer that one.
Yeah, so I think there was a similar question that I answered already, but basically we find that for treated households relative to control households, there was a higher likelihood that they left their houses, precisely because since they were recipients of the transfer, they had to go to the ATMs or to the banks to cash out the money. And so we find a higher likelihood of leaving the home for treated households relative to control households. We do not find necessarily a differential between digital versus cash, but that contrasts with what we find in other contexts in which you would have hoped, and as Olga said, that was one of the original aims of the government, was that providing digital transfers could have helped during a pandemic, help households comply with, social distancing or the quarantine. So the fact that we find no difference between digital and cash recipients is kind of unfortunate given the potential that this could have had, for that purpose.
It's not that it was worse, it was just no better, I think is the important takeaway.
Exactly. It was no better.
Could you also speak a little bit about what the experience was for the people who received the pure cash treatment? How did they receive their payments?
Yeah, so in this case, they had to go to one of the local agents in the municipality. They had to show, their ID, or other proofs of identity, and then they had access to the cash transfer. Importantly, many of the same local agents that were points, of payment for the cash recipients were also points of payment for digital recipients. So if anything, digital recipients had more alternatives to cash out their transfer. So they could go to ATMs of the bank that administers the digital wallet, La Vivienda. They could go to specific, actual branches of the bank, or that could go to many of these other local agents. Now, one important difference here is that, cash recipients, if they don't withdraw their money within a given time frame, the money reverts back to the government, not permanently, but until the next payment cycle. So there was, there could have been the perception for cash recipients that they had to do it quickly, or otherwise they were gonna lose the money, while for digital recipients, once the money is transferred to your digital account, it just stays there indefinitely.
Another question from the chat. Is there any way to disentangle to what extent the results are due to low financial education versus the connectivity or low merchant acceptance of digital payments that we mentioned?
I can take this one.
Yeah, take.
Yeah, so I think it's come up that using the payment technology is going to be highly endogenous to many aspects, including financial literacy, but also connectivity, transportation, how close you are to the branch, whether you have a phone service or we have a good phone that works, whether, just such a range of things. And because this was not a randomized experiment that generated random variation in willingness to use this specific technology, we can't really speak to what are, the key drivers of this. So what we know is that there's going to be big selection on the use of this new technology. That's no surprise. Households who use the new technology as households who are generally living in more connected areas, so urban areas, they are in less poor municipalities, et cetera, et cetera. What my understanding is from showing these results with the government is that the Ingreso Solidario program will have a branch generating random incentives to incur, or randomly allocating incentives to take up the new technology, which will help understanding the causal effects of digital payments. In this particular project, what we see is that digital payment take-up is highly endogenous. And when we try, as we do in the paper, to kind of discuss these things, it's really hard to disentangle what is being driven by connectivity versus something else.
Another question that's coming in from the chat. Do you think that the impact of the transfer would have been different if the amounts were different, if the amounts of the payment were lower or higher?
A good question. I was about to type a response to that. So, it's hard to tell, as Juliana mentioned, the evidence from cash transfers in general, not about cash transfers during a pandemic in particular, but the literature on cash transfers in general does tend to find largest impacts for larger transfers. Now, of course, it's hard to know whether, things would scale up linearly, as is the case with many of these things. Just as some context, the UBI in Kenya was 4 times larger than Colombia's VAT compensation cash transfer. And that holds even if you compare it just nominally or even after PPP adjustment. And they still find relatively modest impacts on different socioeconomic outcomes. I mean, as we mentioned, they do find that it facilitated compliance with the quarantine, but in terms of other socioeconomic outcomes, they also find somewhat modest impacts. So I think we have a sense that, larger transfers have larger impacts, but how exactly to predict whether, a transfer twice the size, how the effect would have been, that's harder to speculate on. So, that's not a very satisfactory answer, but
need more testing.
Yeah, exactly.
Great. One other question that I'll pull out of the chat is related to the VAT compensation program overall. And says that some Colombian experts are recommending a post-COVID tax reform that includes a VAT return and removing all tax benefits, food and goods highly consumed by poorer households. So given the evidence from this study, do you consider it a plausible recommendation to add the VAT cash transfer in the tax reform of 2021? It's a very context-specific question. I don't know if Juliana or Olga want to.
I'm happy to give my own opinion, and then Olga, maybe you should give the official government opinion. Yeah. So the VAT compensation was created by the last tax reform. It was kind of an interesting coincidence. There was a tax reform that occurred in December of last year, before the pandemic, before anyone knew that this massive event would take place. And it established the VAT compensation as a way to help poor households living in extreme poverty. Initially, the law, which is Law 2010 of 2019, adopted in late December of 2019, it established a way to evaluate the program. So they said, okay, so we're going to create a VAT compensation. Part of the compensation, part of this will include a way to evaluate the program. It's going to be a randomized controlled trial, and that's kind of where it stood. What happened later was that 3 months later, the pandemic erupted, and the government was kind of forced to expedite the way the program. Initially, the 2019 tax reform included the idea of having a pilot this year. And that's kind of when I first heard about the VAT compensation. What the pandemic does is force the government to expedite it. So now, instead of having a small pilot, you're kind of having the program run at scale with 1 million households. This is a huge undertaking in just a very short amount of time. I should mention that the government mandated, the first case of COVID was detected in early March, and 3 weeks later, it was already distributing VAT compensation. So it's this really massive undertaking that should be taken into account right now. The program, what we've seen is it had positive effects, though of course modest in size, positive effects on households' well-being. So it did help households in their financial well-being. We didn't discuss this, but we also see some positive effects on their mental well-being, positive effects on access to food security. So the program overall had positive effects. Where we're also seeing is the challenges that Colombia faced, as could be expected, with suddenly achieving this record time expansion of mobile money payments in the middle of a pandemic, right? So we should first take up, I think the main, I just want to stress this, the main effect of the program is a very positive effect on households' well-being in a context of a pandemic. Now, of course, there's going to be challenges, and the method of payment, given the new technology, has its challenges, which we've discussed at length. I think now there's being a discussion about a potential VAT tax reform. That's something that politically, it's historically been very challenging. I think what the experience with the last couple of months shows that Colombia actually can achieve a fairly successful VAT compensation program that's quick and effective in reaching the most vulnerable households. at least to the extent that it did so with the people who are in our, in the initial sample, which is people who are already receiving transfers from Familias en Acción and Colombia Mayor, which is, the 1 million households who are receiving this VAT compensation. If you want to expand further on, there's going to be additional challenges. But I think the key message is that Colombia achieved something that's really quite unprecedented in reaching the poorest citizens in a record time with this new payment technology. So I'll stop there.
I will just add up to what Juliana said, that we are hoping that the results of this evaluation and the medium-term evaluation that we are going to conduct next year will help in the discussion of this new tax reform that is being at this moment being proposed and and it will be discussed for sure, I guess, next year. So we are hoping that these results are taken into account.
Maybe one final question, because we're almost over time. So just after this experience of 9 months, almost a year of this pandemic, will there be any changes in targeting or poverty measurement as a result, or are there any plans to update the targeting given the realities that have happened in the last 9 months?
Very good question. So the government just ended up with the new collection of data for the CISBEN 4, which is the fourth methodology of this targeting system. So it just ended up with that collection data. I will say that the social direction of the planning department is obviously expecting to do some calculations with this targeting and data that was just ended up collected. But I don't think there's in the near future a new collection of data to update that data. So.
Great. So I think we're right at time. There are some other questions that I think have been answered in the chat already. Thank you to everyone who submitted questions and was having a conversation in the chat. The paper is available both on the IPA website and on Juliana's website. And I think she's left a link in the chat there too that we can pull up, but we'll be sending around an email to participants, and we can include the link to this presentation as well as the paper. I want to thank the speakers again, Pablo, Olga, and Juliana for taking the time to share these results today. I think this is a really important study because it's important for folks who are seeking to expand digital financial service adoption globally to understand the experience of a country where that's not Kenya, basically, so a place where, we face different or new challenges in expanding adoption, especially in this critical time, and maybe what some of the limitations are of jumping into a new technology during a time of crisis, but more, helps to give us lessons about the factors that we should be considering when trying to do that in other contexts that could be similar to Colombia. So, pulling out some of these lessons around the challenges that limited connectivity posed, the merchant acceptance, the customer adoption, financial literacy, and people's preferences for using the products. I think it's really important to see these lessons from this experience so that countries and programs that are trying to replicate this in other environments that might be where the mobile money ecosystem is more similar to Colombia than to Kenya, really can learn from these experiences and, hopefully innovate around some of the bottlenecks and constraints so that, we get more and more effective each time something like this is rolled out in this type of context. So thank you very much for sharing these important results. Thank you again to everyone who participated. Do reach out if you have any other questions. We're happy to connect you with the speakers. We'll be sending around again the presentation and the paper to everyone who signed up. So thank you again. Have a great day.